All right, so this is AY-43L. So it'll offload the medial compartment of the left leg and the lateral compartment of the right leg. When you first go to fit it here, we're just gonna undo all the buckles. And then for most patients with a smaller leg, once this is fit, we want these to be right across the back of their leg, pretty much centered, not off to the medial or lateral side at all. So for smaller legs, you can typically just move them in, basically butt them up right to that other piece of padding there. So I'm gonna do that first. For a bigger patient, you might leave them off in this direction more. But for today, we're gonna move them in. One thing to watch for when you do that is you want to get this Velcro strip centered on the strap. If that Velcro strip is hanging off the edge at all, it can rub into the patient's skin. So we've got that set up. I'm gonna go to the left leg here. First two straps are gonna fit. 1 and 2 are gonna be the ones below the knee. And those are the most crucial for eliminating migration. So we wanna make sure those are tight and snug. Gonna go and find the center of the patient's patella, and we're gonna line up the center of the hinge with that point. A lot of times I'll set it just slightly higher because the main problem you can run into with OAs is migration down the leg. So I'm gonna set it just a little bit higher, but pretty much center. The patient's leg is gonna be bent. It's gonna be just a little bit more open than a 90-degree angle, like 95, 100 degrees. Get that there. Then I'll have the patient hold this top part. Yep, just to hold that in place. We're gonna start with the strap right below the knee. We'll go ahead and buckle it in. Now that it's buckled, you can undo the strap. Start to pull the slack out. Undo the Velcro here. I'm gonna slide this down, pull it snug, and fold the slack over. It's also something you could cut the strap on if you want to get rid of some of the extra material. Then this one, since it's the most crucial in preventing migration, we're gonna pull pretty tight and then Velcro down. Then we'll go on to the second strap, do the same thing. Does this one feel pretty snug?
Yep.
Okay. So we'll buckle it in. Gonna undo this. Pull the slack out. Fold it over. Then I'm gonna pull this tight. Again, pretty snug on this strap. Velcro it down. Make sure we're still fit in a good spot. And then we'll go to these top two. So we'll buckle this in. Undo this. Gonna pull most of the slack out and then fold that over. Now put the strap down. Same thing on this last one. We will buckle. This is one for this patient I would probably cut down, get rid of some of that extra strap. Fold over, pull tight. These straps above the knee you definitely want tight, but again, the two below are the most important in preventing migration. Does it feel pretty snug?
Yep.
Okay. Then we'll have the patient stand up, and I want to look at the back of his leg. Looks pretty good. We just want to make sure everything is going straight across the leg. Make sure these extra pads are centered, they look good. Okay, I'll have you walk just a little bit, make sure everything feels snug.
Yep, feels good.
Not moving?
Nope.
Okay, then we'll have you go ahead and sit back down. Again, leg just a little more open than 90 degrees. And then we'll use the Allen key to offload his knee now. There you go. So Allen key right here. Gonna go counterclockwise, I believe. Yep. So counterclockwise to start offloading that. We'll go just a little bit at a time. And then what I would do is have the patient stand up and walk and see if they're feeling any relief. Trey doesn't actually have osteoarthritis, so he's not gonna feel the relief. But if they're not feeling relief yet, then we would go and do maybe another quarter turn. And when you're working with patients with OA, they're used to having pain here. And so when you go to make these offload adjustments, you want to make sure they can differentiate between pressure and pain, because they are going to feel pressure here, because what's happening is this hinge is pushing in while these straps pull out. So if the joint is bone on bone right here, as we apply pressure out here and pull on the leg, we're trying to open it up a little bit and create like a hairline fracture so they're not bone on bone anymore. So there is going to be pressure, but if the braces fit right, they should start to feel relief, sometimes pretty much immediately. So set the offload, have them walk around, make sure they're feeling relief, and then they're good to go.